Yes. Good afternoon, everyone. Today is December 10th, Friday. This is United Medical ACO. We are here to cover our updates for COVID, and there are a couple other healthcare-related items, and we will have a guest joining us. Sean Donovan, as usual, he's with me today. He's going to be giving us updates on the COVID and the other stuff, other discussions he's going to be part of. So later on, Beste Kuru, one of our senior client managers, will be with us. And we are going to start our session. All right. So Sean, how are you doing?
I'm doing well. How about yourself?
Good. So now we are used to this. Not the fourth one or the fifth one, fourth one.
Can you do third, maybe?
It's more than three, definitely.
Yeah. Well, comfortable wise, maybe my third comfortable.
So today, from the COVID numbers, we have some updates, and then the RCM, the billing, medical billing, again with Beste, and then we are going to talk about Neuralink and prescription drug prices, and also what's coming up for next week on the depression in youth. Those are going to be our topics. So we'll start with our updates from the United States and around the world.
Yep. So we have our updates here. This is again our COVID-19 infections and the numbers there. I did highlight there just on the side on the left. You notice last week it was around 82,000 infections, and now it's a significant increase. If you see the number for the United States, up to over 122,000. So just pointing out that significant increase there for the nation as a whole. And then on the right, it appears that the US doesn't really have an up or down trend with the deaths associated, but still almost 1,300 there is definitely a significant number to be paying attention to. And then again, our chart right here is now as we get further into December, you can actually start to visualize and see that uptrend forming as we go into the winter towards the New Year's. So you see, it looks like maybe around Thanksgiving, beginning of November time, it started that uptrend, and it's obviously continuing now. And as we are having these high spikes in numbers as the Omicron variant and Delta variant are both still persisting.
So we were actually kind of expecting that anyway, right?
Yeah. So definitely as you approach the New Year's, like I said, with the holidays, we are kind of, like you said, anticipating that increase. And then just on the global side here, again, Cuba is still at the top. They passed that threshold of, looks like 250% to the population with their administering of the vaccinations. Again, that is the top 15 there. And still, the United States is not in that top 15 chart with vaccination administration.
So in terms of total vaccination and the daily numbers, I think we are doing slightly better than last week, right?
Yep. So it did increase. Obviously now it says that we're at 475 million doses of COVID vaccine so far. And then you see the number there, it's almost 73%. And then in the graph, obviously on the second image there is displaying that uptrend. So it is increasing, and then the number actually has increased too. So it looks like 1.4 million doses being administered on average each day. So we're definitely increasing there. And now it's down actually to days. If you notice, it used to be how many months it would take to administer the doses for another 10%, but now we're at 48 days. So definitely increasing and going in the right direction. We could throw that out there for, like you said earlier, the youth population is now able to be receiving vaccinations. We also have more boosters being available. And then also just the concern, with the Delta and Omicron variants, where people may be more inclined to be getting their vaccinations, especially as we approach the holidays.
So this is something that I wanted to actually share with you guys. So it's kind of, we took the politics out of this. But actually it was a political slide, I guess. I kind of like the image, not like I like the image what I see, but I like the image that's demonstrating the issue that we are describing or we are going through. So, Sean, this side of the left side is the people who are vaccinated,
Yep.
and the right side is the people who lost their lives. So,
Yeah. Yep. So each of those gray dots is going to be representing a different county. So they broke up obviously all the counties in the country. So each gray dot is a visual representation of a county, and then, as you mentioned, the left graph over there is going to be displaying the vaccinations. So they kind of averaged the counties. On the left side, you'll see percent of adults vaccinated. So that blue plus is kind of representing the average there of higher vaccinations in those groups of counties. Correlated over there on the right, as you just circled, the blue plus is showing you the correlation to the deaths of those vaccinated. So those same counties that had higher vaccination rates are also seen over there as being the lower death rate. And on the opposite side, the red plus is kind of demonstrating those that had a lower percent of vaccines in the county's population is actually experiencing the higher mortality on the right graph there.
This is a very powerful picture. Now, again, I don't really care what the politics are, and then we block them, as you can see here. And then we slipped the bottom part of this picture. But I think in terms of the picture itself, the image itself, it's giving us a very clear message. So your vaccination numbers going down, your number of people who are dying going up. So that's clear. This is statistics. I mean, I always go by the statistics. I mean, I really don't care about what the actual opinion is if it's not supported by data. So this is something that's supported by data, and I think it's extremely powerful. So if this doesn't do it, there's nothing else that can do this better. So total number of people who are vaccinated in the United States as of today, like fully vaccinated, we are a little over 200 million. And also people who receive their booster shot is about 49 million. So I think the population with the elderlies or older population, I think we are doing a much better job, right, Sean?
Mm-hmm. Yeah, when you break it down by age group, like you said, I believe it's you can label them as seniors, but the elderly population here is definitely more vaccinated. If you look at the percentages, the age breakdown, as you see down there, it's 99.9% as opposed to the total average of being 71.4. So like you said, earlier on, I know that they initially made vaccines available to the older population when they were first coming out. So obviously that played a part, but also just those who, might have a weaker immune system as you age and just kind of want that safety net for sure.
Well, that's definitely.
Yep.
So, and then in Delaware, we are fully vaccinated at 554,000. I believe Anthony Anugu is getting us in touch with the state, and in the next couple of weeks, one of the state medical directors will be part of the event. So this number is very slowly increasing. So we did really good in the beginning, but I think now we are kind of staying at the same level.
Yeah, definitely starting to plateau for sure.
Yep. So now I actually want to share something with you guys. So as we own medical offices and we provide services for medical offices, one of the things that is happening is I get a lot of feedback. Sometimes these feedbacks are coming from physician offices, or sometimes they are coming from the patients. So all of our patients, they do receive a survey. And then with those surveys, then they actually have to send, they will send their feedback. In some cases, I get calls from our physicians, and there was a patient who was not really happy with the way of getting to the call center. And then I just took the name and then I said, well, can I actually call this patient? So this is one of our United Medical Clinic patients. On the pediatric side, Sean, you may actually know these now better than I, with the patient portal, with like one parent can manage more than one account with the same email, so then they don't have to have several accounts. So, and then this patient was struggling. 2 kids are on one account, and the 2 kids were on a different account, and she was struggling. So now, what was really interesting is there are 4 kids, ages 23 months to 7 years old, 4 kids, and this is directly from my my day, the anecdote from my day, episode from my day. This family with 4 boys, 23 months old, 3 years old, 5 years old, 7 years old, all 4 are COVID positive. So imagine like if we didn't have telehealth available, how bad the situation would be. The mother of these patients, very knowledgeable mom, that she knew that she shouldn't take the kids to the hospital, obviously, but she couldn't also bring the kids to the office, so she just needed help. The kids were doing okay, but then the issue of like you have 4 kids and then all 4 are going through this horrible problem at the same time, that's just like scary. And this is real. So that's what we want to actually point out. We're not trying to scare you or anything, but that is, that's the reality. I'm not trying to scare you, but I think Sean is trying to scare you guys because he wants to share this cartoon.
Yeah. So our political cartoon of the week here, you see we have a little fighter plane up top and it's labeled the Congress of Infamy. Obviously you see it's starting to sputter out, and the weight that it's carrying obviously is the big government and their debt bomb that obviously it looks, the idea of the graph is it's pending any minute now to drop a giant debt bomb.
So is it going to come on top of us or what?
I certainly hope it doesn't land here. But yeah, the idea that the big government spending, obviously passing of those large infrastructure bills that would kind of recently happen, the fact that the debt is just exponentially increasing, makes you kind of wonder what's going to happen down the road when that threshold's met where you can't take on any more debt and something's going to have to give. So just to keep that in the back of our minds, all the impact it's going to have, both obviously on the economy, but also healthcare, and also the health of people, as that debt is continually growing and looming.
And that's something that we were actually talking about. There is very similar to the Worldometer, where I used to get the COVID numbers. So there's this other application for the US debt calculator. And when I shared that with Sean, he was kind of freaking out the first time when he saw that, because numbers just going up. So it's over 23 trillion right now, which was about 22 trillion at the end of 2019. So in less than 2 years, it's about 32% increase. And this is something that we will end up dealing with. So I think one of the reasons that we wanted to share this, and I think it's that on cartoon is a good one. So we are going to ask our senior client manager, Beste Kuru, who was part of this event at least a couple times, and she's one of our leadership members in United Medical. Hey, Beste, how are you doing?
Hi, Kemal. I'm good. Thanks for having me.
Thank you for being with us. So we want to talk about one of our services that we do, obviously, is the RCM and the medical billing, commonly known. So if you can explain to us part of your day-to-day issues that you are dealing with, and how you are actually working with those issues, what United Medical does. So,
of course. Hi, everyone. So as part of the RCM team, what we do is actually acting as a bridge between medical practices and payers. And we try to correct the mistakes maybe that happened on the practice end, or address the payer stemming issues And today we just wanted to talk about the most frequent denial from payers and the major problem that is causing delayed payments, no payments for practices. So Kemal, I did want to share this. This was an article you published actually back in June 2020 on LinkedIn, Mastering Revenue Cycle Management. And there, I quote this from there: insurance-related issues make up about 40% of all claim denials. And this is still valid and supported by our own data. The next slide, I am just giving a summary of only the last 12 months of our corrections on the client accounts. Out of the about over 106K corrections we made only on the preventable side, about 20% come from incorrect or missing insurance information for patients. And that is just one part of the eligibility issues, right? So we are looking at a picture where eligibility related denials are making up a majority of the problem on the preventable end. Other examples of top denials that make up the eligibility issue is maybe providing incorrect ID, relationship, or date of birth, or just entering those incorrectly into the PM system at the practice end. And again, this is almost similar, like very much similar, but we are just identifying these in more detail whenever there's no insurance coverage for the patient. So maybe eligibility was not verified at the office. And again, when a patient is a Medicare patient, there are cases where the patient has Medicare HMO rather than the traditional Medicare.
So these are our D codes, correction or denial codes, right?
Correct.
So these four, you are saying that they're all about patients do have insurances, but we don't have the right one. They do have some coverage, but we don't have the right one in place.
Correct.
Right. So now, what's the root of the problem? Like, where do we get that incorrect information?
So mostly it comes down to not verifying through the correct channels in a timely manner before the visit. So what often happens is patient maybe comes to the office with an old insurance card. Their maybe eligibility was not verified prior to the visit date. So the front desk just accepts the card as is, doesn't even verify the information on it. And then just the visit happens with the provider. And later, once the charges are entered, what happens is we are like the system, the practice is basically trying to send the bill to the incorrect insurance, which will not even be able to maybe identify the patient, or will say that, no, we don't have coverage for this patient anymore. It was, 3 months ago that the coverage ended.
So, the interesting part, Besta, with this is, there's no other business in, like, at least what we know, there's no other business where you don't actually get paid day after you provided the service. And you go to doctor's office, patients think that they're paid already, and then they're not. So how long does it take to get paid? If there's no problem with the claim, what's the average payment lag?
I would say for, of course, there's standards too, but it will differ per specialty maybe, and where the patient is seen, whether it be in office or hospital setting. Ideally, and this translates as a days in AR KPI in metrics. Ideally, we would say under 20 days. If the account is clean, the system is running smoothly, everybody is doing what they're supposed to do in a timely manner, we see from 15 to 18 days. But for problem accounts, that's usually not the case, right? It climbs up to 40s per MGMA. Maybe the upper limit is accepted as 40, but we do also have cases where it is far above 40 days, where it takes about on average to pay the claim. Well, it is preventable, and it is actually sounds like it is easy, but somehow the flow management on the practice end is not very easy to do. I understand, but we just want to highlight here the importance of verifying eligibility correctly upfront, and I will also list some suggestions for the practice end. Well, if we are able to verify eligibility correctly upfront and in a timely fashion, it will translate as increased claim rate, right, and increase in cash flow for the practice. And we are hoping to see improved rates on denials, which means less denials from the payer and more direct payments and less eligibility PCP or coordination of benefit issues. And again, it comes down to how many days it takes to get the claim paid, which will mean improved days in AR and faster payment. And what I suggest, and we suggest as a team here, consistently to our clients, is to create and follow a routine workflow using always digital means to our advantage, verifying eligibility, taking SNPs, proofs that what is valid between which dates and what is covered. And we want to also verify eligibility, PCP, COB type of information prior to the visit, and definitely confirm if you are able to on the date of visit to make sure there isn't any change. And it is also very important to get your patients to take action prior to the visit. For example, if there's an older balance, if they had to contact the payer to update their PCP, COB, we need to engage the patient and make sure that they take action. They call the insurance and they make these necessary actions to help get the claim paid. It's also important that we train personnel and make sure that they understand how their role directly impacts the revenues for the practice. And again, using digital platforms like insurance portals, Navinet, Availity to verify this information.
So now our practice management PM system, it does actually now check all the eligibilities ahead of time. The issue is system checks those, but then what you do with the data, right? So that's kind of like the problem these days, where we have so much data, but we don't have, if we don't act on it, then you cannot use it. So it's not going to be helpful. So now what we are trying to say here is there is a preventable issue that's happening that's impacting our payments. And this comes from our practices to our business office, back to the insurances. And there's always this perhaps issue of accountability. So now we wanted to discuss the service that we are providing, but also when we find out what's not happening, how do we keep people accountable, or practices accountable, or the businesses accountable, or the insurance company accountable? So preventable, just the way that the word, it means something that can we can actually stop happening. So we can check the eligibility before patient gets there. We can get the co-pays at the time of the service. We can do so many different things. And if they do everything perfectly, they may not need a billing company. That's and then I don't mind that, because we own practices, right? So, but the thing is, we should be more accountable. So this part you are not actually, you probably didn't see what was coming from here. So you did your RCM update, and thank you for being part of this, but I do want you to stay if you have time. So because the thing we have from here is, since Sean started, and Sean can come up as well, so we wanted to add a couple new things to what we are doing. So you discussed this preventable issue and what we are doing, how we are actually dealing with. So one of my retreats that we used to do when we were able to do things in person for United Medical Leadership. It was the leadership retreat, and I'm hoping that we can go back to those events one day. So one of the book assignments that we have was crucial accountability. So which is kind of in some cases it's being confused with crucial conversation, but this is actually crucial accountability, which does include the conversation piece. So this, from the business side, this book is extremely strong, right to the point, and it's one of the books that I actually recommend our management teams. I know most of them should have this, either the print or the audio. And I think it can be used for what's the issue that you are describing. And just to kind of see what was, like, this is like, we talk about here, like violated expectations, broken commitments, and bad behavior. Now, we are not talking about like the emotional relationship, we are talking about business. So this is a business book, although it can be used for the other stuff as well. But if we are discussing here is something preventable did happen, then someone has to be accountable, right? So the part that the issue that I'm always having a difficulty with, if they're not accountable, and if we are not making them accountable, then how are we going to actually move on and fix it? So we don't want these issues to happen. So we want our medical offices, check in, check out, back office. Everyone should be taking their job seriously. And also same thing for our offices, the account receivable representatives that we have, our managers, our leadership. So we can't take these for granted. So we have to be accountable for what we do. Now, anyone who is interested in this book, I don't get any commission from it, but I can buy it for you if you don't have it yet. So it does actually come with some tools that can actually that can be used for different exercises, and I definitely do want this to be utilized by our management team to identify these issues. Now, Alyssa, were you at those events? Like, did you make any of the?
I was not part of the retreats at the time.
The last one we did was 2017 or 18.
I mean, we had a bunch afterwards, and yes, I was part of the 2017-18 ones, but not the earlier ones, I guess, when you went more in depth into maybe discussions of similar books in management.
Maybe. Now, I know Sean is going to read this by next week, right? And
in there right now.
There will be a brand new Sean coming back.
Right.
All right, so that's kind of what we wanted to have from the RCM side, and then kind of just tying that into our the book advice, and not the review necessarily, but more like an advice. So if people are bored and then they want to actually learn a little bit more stuff on the technical side of it, it's a pretty strong book to address some of those accountability issues and helping us to have some of those uncomfortable conversations, because many of us are not really confronting the issues in a proper way, and we do need some education, some knowledge to address those, and it's a really good, great book. Now, I know, Beth, you've been with our leadership team for a long time, and I always admire your approach on the problem solving and addressing the issues, and you are doing a great job. And I know that clients are happier, and we want to make sure that we can actually take that and then make it part of our United Medical culture, so that we are always accountable with what we do. You know, just one little thing, it may not be fully related to what this is, but yesterday when we were getting ready for the event, and we did let you know a little bit late, and then I was way too late to let you know, but I didn't realize that Sean actually they communicate with you way earlier than I did, and I didn't tell him to do that. Right. So, but what it means is that stay accountable. So he's part of this, and I was busy with several different meetings. And when you were leaving last night, when I was trying to tell you nicely, I'm like, she's gonna be like not happy. I'm like, and then you said, well, you already sent the slides, and you already knew what it is. And I was happy that you did what you did, but also I was happy that Sean picked up that issue and then did complete that piece and made it seamless, and then everyone was ready. So that's part of the team, and I'm part of the accountability, and I really do appreciate that. So, well, thank you for joining us today.
Thank you, Kemal.
So you'll see you tonight at the holiday party.
Maybe I'll make an appearance.
All right. Okay. So our next topic, Sean prepared with me is Neuralink. Now, this is a really innocent picture of Elon Musk. So what I want our people to see is when you look at this picture, and then when we give this news with this picture, probably you would feel like, oh, this is good. It's a good, it's a good perception out there, right? But then, if the same news, same Neuralink comes from this guy, you may actually just take that with precaution and then see what this Neuralink does. Now, did that do that to you, Sean? Like when you yeah, I know my haircut is not the best, but I do have a reason.
I still trust you regardless of your hairstyle.
Thank you.
Yeah, definitely.
This is a good one. So this is a good picture. And then here, let's talk about over this picture because this is the latest one, right?
Yeah. So obviously the first one looks like it was a professional headshot. Looks like maybe it has some makeup. The lighting's all perfect. Whereas this right here is a screenshot from his live stream interview he had the other day. And obviously he's rocking a new hairstyle there, keeping it short on the sides. But, overall, like you're saying, it's just the image and, what immediately jumps to your mind, maybe like the mad scientist here. What is he trying to work on as opposed to the professional?
That's the Spider-Man, the evil guy on the Spider-Man.
Yeah.
Right. So now, actually, by the way, I haven't seen Spider-Man for so long, so people think that I'm just watching them. So now we are not going to talk about Elon Musk. I personally do like him. He's a visionary guy, and I think as long as he's managed to a degree, because some really smart people, they can go crazy, and he may be at that point maybe in the next couple of years if he's going with this direction. But I think what we want to discuss is the Neuralink. Neuralink is it's been out there for a while. So, and then Elon Musk actually started investing on this in the last couple of years. Mm-hmm. So we wanted to share this, what may be coming for healthcare in the near future. So Sean, you prepped some stuff for us. If you can kind of explain from what your understanding is with these articles, and then we can have some conversation around this.
Yeah, sure. So, as you said, he has been investing and kind of working on this idea of Neuralink for the past few years now. For those who are maybe not as familiar, basically it's the idea of a microchip being inserted in the brain and kind of interworking and communicating with the neurons in the brain to sort of have some type of artificial intelligence aspect and features take over. Which you'll see later on when we mention the monkey as an example. But obviously the idea that the brain being the power engine of the whole body, how it communicates. One of the main focuses Elon always mentions in his interviews is the fact that he's trying to hopefully have people who have paralysis utilize this Neuralink. That way the neuron signals are still able to communicate, throughout the body. So the idea here is this artificial intelligence chip and being able to promote the overall health of obviously people. I think he said in his article he's hoping by April of 22 to be able to get it in actual human beings. As for right now, they're doing it in test animals. So, monkey.
Sometime in 2022.
Yeah. But yeah, right now it's just being used in obviously labs testing with our monkeys or pigs in the one example. But yeah, just overall the artificial intelligence and the positive impact that it'll have on humans and healthcare and the health of people as a whole.
So like we have read several different articles together. So part of the I think in this case part of the issues what we understood in the examples that they are given, actual brain functioning just fine. So the brain signals don't have any problems. So it's just those signals to be transmitted into the body, and then if the body can actually function. So I can see how useful that is. But then I'm going to try to play the video. So then let's just hear it again. So there's more into this because there's more into the AI learning, what you are doing and who you are, and then how actually it can maybe change who you are, if it can be if the advancement gets to a certain point, it may be out of control, honestly. So let's actually, usually when we play these, they're not the greatest. I'm gonna make sure that I do this right, and then share sound is on. Let's see how it goes.
So Neuralink, we have Neuralink's working well in monkeys, and we're also doing.
So hold on one second. I just need to make sure I increase.
Just a lot of testing and just confirming that it's very safe and reliable, and that the Neuralink device can be removed safely. People may have seen the demo that we published earlier this year, the video of a monkey playing the video game Pong telepathically using the Neuralink in its brain, and it's completely wireless, charges inductively. But basically, the monkey looks completely normal, and yet is playing a video game telepathically, which is, I think, quite profound. We will have, we hope to have this in our first humans, which will be people that have severe spinal cord injuries, like tetraplegics, quadriplegics, next year, pending FDA approval. And I should say, our standards for implanting the device are substantially higher than what the FDA requires, just as our standards for safety with Tesla are much higher than what the US government requires. And I'll take a little more than 60 seconds.
Yes, I'm about to cut you off.
Because I think there's something that's I think pretty cool, and I do want to say that I'm very, emphasis on cautiously optimistic about this. I think we have a chance with Neuralink of being able to restore full body functionality to someone who has a spinal cord injury. Meaning,
I think that's the kind of like that's important to kind of understand what it is that he's trying to do, and then it's going to be useful. So we have to be optimistic. So today we are doing surgeries with robotic surgeries, and it's totally different world that we live in. But I think one of the concerns that I had, one is with this monkey. Actually, this monkey does more than what they're saying it's doing. Now, Ethan or John or one of my people, if they can actually let me know if the sound quality when we are playing the video is okay.
This is Pager. He's a 9-year-old macaque who had a Neuralink placed in each side of his brain about 6 weeks ago. If you look carefully, you can see that the fur on his head hasn't quite fully grown back yet. He's learned to interact with a computer for a tasty banana smoothie delivered through a straw. We can interact with the Neuralinks simply by pairing them to an iPhone, just as you might pair your phone to a Bluetooth speaker. The links record from more than 2,000 electrodes implanted in the regions of Page's motor cortex that coordinate hand and arm movements. Neurons in this region modulate their activity with intended hand movement. For example, some might become more active when he moves his hand up, and others when he moves it to the right. By recording from many neurons and feeding their activity into a decoder algorithm, we are...
So basically, the people who are interested in that, they can actually watch this. But there's one other video, if I can bring it up, where this is the Neuralink monkey, and then there's a Neuralink pig. So this is, let's see how this is playing.
Okay, this is a high energy pig. All right, Gertrude, thanks for coming out. So what the beeps you're hearing are real-time signals from the...
Are you trying to share the screen as well, or?
Next to neurons that are in her snout. So whenever she snuffles around and touches something with her snout, that sends out
there you go.
neural spikes, which are detected here. And so on the screen, Gertrude, thanks for coming out. Neuralink connects to neurons that are in her snout. So whenever she snuffles around and touches something with her snout, that sends out neural spikes, which are detected. Each of the spikes from the, then you can see pig, initially shy, but...
So in this one, there are 3 different pigs. One Neuralink was implanted and just taken out. In the other case, it stayed for a couple of weeks or a couple...
yeah, I think they said it was 2 months or so. It was...
last one, 2 months, it stays there. The last one is going to stay there.
Oh, so, yeah, the last one. Yeah, the one that they removed it from was a few weeks. Yep.
Yeah, so that actually is the one maybe the concerning part is maybe there, because if we are going to make this chip learn everything that we are doing now, like I'll tell you this, I would probably do it. So, call me crazy, but that's what it is. So I would do it. I would, if it's once it's approved, then I would just have one on my brain, and then just I'll use it if I need it. But we still need to be careful. So this last video that we are going to play.
Say tomorrow you get a phone call from Joe Biden and he says...
I think that's unlikely, but sure.
Okay.
At least no one at Tesla is actually...
Everyone is talking about the infrastructure plan and the bill, and I wanted to ask you, say tomorrow you get a phone call from Joe Biden and he says...
I think that's unlikely, but sure.
Okay. He just gives you a call and he says, I haven't been talking a lot about Tesla lately, but what do you need from this bill? What are your needs? What do you answer him?
To be totally frank, I don't know if at least no one at Tesla has actually brought up whether they care about this bill or not. I think if this bill happened or didn't happen, I don't know. We don't think about it at all, really.
Okay.
It might be better. Honestly, it might be better if the bill doesn't pass, because we've spent so much money. It's like the federal budget deficit is insane. It's like $3 trillion. Federal expenditures are $7 trillion. Federal revenue is $4 trillion. That's a $3 trillion.
So part of this is the same person talking about 2 different issues, right? So then he's in charge of the Neuralink, who's going to change the way that who we are. And then again, some people really need to change. I don't have any problem with that. Some people should change. Especially those who think they shouldn't change, they definitely need to change. But in how we can actually control this without killing the creativity is kind of important. So when he talks about Tesla and the government and other stuff, and then how government needs to stay out of everything else, but then he's in charge of something that's going to change the entire behavior, human behavior, so, or animal behavior in that case. I think it's kind of like scary in a way.
Yeah,
right?
I mean, if you even just think of that one video where he was saying that the certain level of safety and caution that they're taking actually supersedes that the FDA even required in the first place, kind of just makes you step back for like how are these like insanely low, you know, requirements that the FDA is having as their bar that for us to eventually put these microchips in these people's brains, that he said that, you know, obviously Tesla and Neuralink are going to surpass their safety precautions, which obviously is a good thing that they're not at this bare minimum threshold, but kind of just makes you wonder, like, are there other things that are out there that maybe aren't surpassing it, these thresholds, you know?
Well, no, definitely there are other things, that it should be like there should be a good way to monitor this. It cannot be just like, well, let him do what he wants to do, versus it has to be watched very clearly, carefully, not clearly, but carefully. So it is something that we need to know what may be happening. Now, I personally do believe that there is some other development, like in the country like China, who may be already cloning people, like human beings. So like, because there's already the monkey and other animals already happen, and I wouldn't be surprised if they did it already. Now they're going to call it now, but again, 2 years from now, when that comes out, I need you to give me credit for that. So
credit here first.
I mean, because they're hiding these things, they're keeping them a secret because they don't. Some of them are unethical, some of them are they want to keep it so then others don't know. But anyhow, so we do want to talk more about the Neuralink in the next sessions. Now, I know we have limited time, and I do want to share one other thing before we go. This week is the American Turkish Association, the American Turkish Society. There is a New York Turkish Film Festival. This is the 18th year it's happening. Myself and United Medical, we are sponsoring one of the movies that's gonna play on Sunday. But if anyone is in New York this weekend, there are so many good movies out there. And this is a great event to participate. And we are, again, happy to be part of it. And hopefully we want to do more in the next years and the future years. But This Is Not Knowing is the movie that we are sponsoring from United, and that's going to be on Sunday. So if you are in New York over the weekend, come and participate. So it should be fun. They're all really good movies. I saw a couple of them, and excellent movies. So, well, tonight is our holiday party, and I know office is kind of going crazy, and then they think that I'm crazy doing this on this day, but we have one more event coming up in the next 10 minutes at 3 p.m. Bariatric Friday with Dr. Erkan. So we'll see you in 10 minutes. Until the next time we see you, please stay safe.